Hello and welcome back to the Evolution of Medicine news videocast. It is Saturday, the 23rd of April, and we are excited to be back for another week of the news. This week's sponsor is actually our first product that we've created at the Evolution of Medicine. It is a 60-day practice accelerator, and we just opened the cart yesterday for the first intake of 100 practitioners from around the world who are interested in building a more successful and sustainable practice in 60 days using the most up-to-date technologies and learning from the best practices all around the country. If you'd like to join, go to goevomed.com/accelerator to find out more about it. I am back here as ever with my partner at the Evolution of Medicine, Gabe Hoffman. Welcome, Gabe. How you doing, man?
Good, man. Good to speak.
We have such an interesting week of news here. You know, I think if there's a theme that we'll see is just that kind of science is broken generally, which we found some interesting articles and also got some interesting articles sent to us by our community. So there was a great article that was sent to us from Slate, which is Cancer Research is Broken. It says there's a replication crisis in biomedicine and no one knows how deep it runs. So Gabe, you were looking in at that, that article. What did you see that was interesting from that article?
Well, one thing I want to start with, James, is just it talks about the problem with replication and how that's always been known as an enormous crisis in psychology. And I think Kelly has given us some great information on that before.
Absolutely, yeah. She calls it the wastebasket, where essentially there's no objective analysis, there's no blood test. It's all subjective data from from speaking to patients.
Right. So it's very difficult now with cancer research. It's making a parallel in that we're investing billions and billions of dollars, and we're not getting the results we want. Cancer deaths are going down, but not as quickly as was originally hoped for. And in light of the news we talked about last week, where Sean Parker was investing money to sort of bring the top minds together, what this article is exposing is the issue with the way that the experiments are actually produced. So not only are we're investing all this money into cancer research, we're not necessarily getting the outcome we want. Where many times the research itself is tainted in that they're being sloppy, the data is corrupt, the findings are unstable, the science doesn't work, and that causes another problem in reproducing results, which is that they've actually tried to reproduce cancer research studies, and only 20% of the time are they getting the same outcome. So that means that it's become very challenging to even know how the initial study was done because steps are skipped, it's not kept track properly, and they're hiring private research labs to then reproduce the results. And so a lot of times you can't get the data from those research labs. There's just a lot of moving pieces here. It's an excellent article. I really recommend everyone take the time to read it because there's so many interesting pieces that you wouldn't even think of, where there's just breakdowns in research just based on the fact that humans are involved in it.
Yeah, absolutely. You know, it's really interesting. It says resulting waste amounts to more than 28 billion. That's 24 cancer moonshots misfired every single year. You know what it reminds me of, dude, is this is the war on cancer, right? And it reminds me of the war on terror, right? Maybe it starts off with some sort of good idea, but there's so much money and it's so disorganized that you just see that, balls get dropped. It's hard to reproduce. Things are messed up. Money is disappearing left, right, and center. 28 billion. That's 24 cancer moonshots misfired every single year. Super interesting to see, that the sort of parallels between what happens when you throw a lot of money at a problem like a war and you end up with, things not being done in the right way.
Well, it's interesting. You compare, the war on cancer to the war on terror. And I think both of them are, how much do we really, what is cancer really? I think that's one of it. Just like what is terror? David Cross had a great line in his stand-up 10 years ago or 15 years ago where he says, you can't win a war against terror. It's like fighting a war against jealousy. It's just, there's not like a place, it's an idea. And are we fighting wars against ideas? And when you try to do that, similar to maybe with psychology and depression, I mean, these are states of being, but they're not necessarily people and places. And so when we wage that kind of war, does it lead to chaos and confusion and this type of thing? Is that just like inherent in what we're actually choosing to say we're going to fight? So it's interesting. I want to add one other piece that's from this article. There's something called the Reproducibility Project for Cancer Biology, started in 2013 with the Laura and John Arnold Foundation. And they chose 50 highly influential papers published between 2010 and 2012 and they set out to work in concert with the authors to reconstruct the paper. And here it says here, at most, I think they got 20% they were able to reproduce. And that's with the people. They're working with them who initially did it. That's how, challenging it is. So there are groups, and they came across a lot of obstacles in getting the actual, how the experiment was conducted, all the technology and all the materials they would need to produce it. So there's clearly an issue here. And if no one's looking at it, like you said, $28 billion, it's one thing to feel like we're fighting a war against cancer is not the right approach. It's another thing to actually just assess if it was the right approach. Are they doing it in a thorough way? And no, this money is just being thrown at it, and it's really disorganized.
One of the things I thought was interesting, and I think that's a great point, super disorganized. Now, what do you do as a patient or a doctor, right? Now, this is like information ahead of time. How do you actually interact with the medical system when you realize that this is happening? Because you're putting all your faith in evidence-based medicine, and if the evidence system is not really all that, you have to think about what you're going to do. So it's interesting to see here on this page, oh, look who's advertising on this page. The Cancer Treatment Centers of America with the power of integrative care lives here. Because obviously, as you become potentially less and less excited about evidence-based medicine or, new clinical trials or otherwise, because you're not sure exactly what's going on, you have to come back to something that you can rely on. And in a certain way, integrative care is that, because it's, a lot of it is proven. A lot of it is about health creation rather than disease fighting, which is going to be sort of objectively valuable no matter what disease you have. If you're having healthier habits, if you're integrating modalities that have, synergistic effects, help the body communicate better, help the body regulate better. These are things that you can sort of bet on because they're not going to throw the system haywire. And it's not a massively disruptive intervention like obviously all these other things that have been researched, which are different kind of drugs or combinations of drugs that are extremely toxic. So I just thought it was interesting to see Cancer Treatment Centers of America in there, because that it's like what do we as doctors or patients do when we see that this world is messed up? We have to go towards something that we know is solid, and any type of health creation in the integrative space is a solid strategy.
Absolutely. And it's, maybe what's going to become I could see how important these articles and this type of research becomes, where we're researching the research. Because if you start to show the fact that science and what's been considered what's guiding us, and people are anti-science who don't believe in this, well, what's science? Is it a bunch of studies that are really not being kept track of? Like, are we just looking at the part of it? And we talked about last week too, who's paying for the study and wanting to put that on the front page of the scientific, of what you're looking at. And just to say one other thing, that so when they only came up with 20 to 25% reproducing of those papers, they said that there's a rule of thumb among venture capitalists that basically the industry was not surprised by the results they found. And the rule of thumb between venture capitalists is that at least half of published studies, even those from the very best journals, will not work out the same when conducted in an industrial lab. For this to be what we're talking about, like it's running the show, and for that to be the standard that it's held to and the expectation, it's kind of a joke.
Absolutely. Well, this was such a theme in the things that we were sent this week. So, it's very interesting. I got some interesting announcements too. So I'm going to come back to this other article. But Fiona Godley has been someone that's been quoted again by Dr. Kelly Brogan in her forum in April 2015. She had a quote about big science. I think Dr. Fiona Godley is the editor of the British Medical Journal. She says, I think we have to call it what it is. It's a corruption of the scientific process. There's this article here about her challenging corruption in science. Well, some exciting news that we have for everyone, seeing as this is the news, is that Fiona will be appearing on the Functional Forum from London. It's actually going to be shot on the 1st of June, and then it'll be coming out as the Functional Forum on the 6th of June. And I very, very much look forward to hearing her thoughts on a special Functional Forum from London. So, yeah. So that's a pretty big coup, and thank you to Dr. Rangan Chatterjee for making it happen. So yeah, this other article that I was sent this week was on a similar vein. This was from The Week, and it just said, science is broken. That's the thesis of a must-read article in First Things magazine, which William A. Wilson accumulates evidence that a lot of published research is false, and that's not even the worst part. So this was actually, in a similar vein, the replication crisis. And, a lot of people in science will say that there's self-correcting mechanisms to make sure that the truth will prevail. And Wilson makes a convincing argument that those self-correcting mechanisms are also broken, which makes it a doubly big problem.
Yeah, and you could see here, it's very similar. 2011, a pharmaceutical company, Bayer, looked at 67 blockbuster drug discovery research findings and found 3/4 of them weren't right. Another study of cancer research found 11% of preclinical cancer research could be reproduced. So same thing, I guess there's a theme that's out there today. And the question is, if, Fiona's quote, which is that science is broken because humans are doing it. So is science broken? Or, science doesn't exist in a vacuum. It's being conducted by humans. And the idea that it's infallible is I think it's the definition of science as we have understood it, or as it's being portrayed, is being exposed for what it is, which is something that humans are doing. And if humans are doing it, it's not going to be perfect. It can't be. And so therefore we have to act accordingly, right?
Yeah, exactly. No, we have to act accordingly. And it's interesting, this BMJ data they've been talking about was this corn oil versus saturated fat. So that comes back into the wheelhouse of our community. And, I think most people in our community feel like a lot of corn oils and vegetable oils are not probably as healthy as people think. Patients do get hurt. And I think I think this is interesting. So this is another good article, definitely worth looking at. But I think, when we look at the corner of where sort of hope and greed reside, nowhere is better than Silicon Valley. And obviously a big story this week, this is probably the biggest news story, has been Theranos and what's going on. So if you don't know about Theranos, it's a lab that promised to be able to get all of the data that you need from one drop of blood. And it had it still has a multi-billion-dollar valuation. And Elizabeth Holmes, the CEO, is the youngest female billionaire in the world. They promised the world cheap, painless diagnostic tests taken from a single drop of blood. Those promises have been cast into shadow by allegations in the Wall Street Journal and other news outlets that the company's tech does not work. The Theranos saga has stirred up a bunch of attention, so it was only a matter of time before the feds came knocking. So one of the things they say in this Wired magazine, Gabe, is that Theranos is under investigation for fraud, which is not normal, what they call weird for a private company. It's interesting. Obviously, there was 23andMe that was for a while put under the shackles of the FDA of giving certain health information based on genomic data. But it seems like, it's interesting. You've got Sean Parker on one side of this sort of like Silicon Valley meets science area, where he's giving money to try and bring practitioners and scientists and everything together. And then on the other hand, you have stories like Theranos, where there's, when you can come up with a really exciting idea, people will get behind it. Whether or not it's, really executing it remains to be seen.
Well, it's the hope meets greed concept is amazing, because if you talk about an idea that gets people excited enough because it pulls on the heartstrings, you can certainly extort a lot of money. And hopefully that's not what's happening here, but it looks like what they're talking about investigating is, has Theranos been manipulating their data to look like their tests are more accurate and more consistent than they actually are, and knowingly doing so. And in fact, this is being used. It talks about in the article the fact that if you're knowingly doing that, these people could end up with jail time. So it's a really serious, and it's something that when they talked about this concept of a drop of blood and getting all your information, it's very sexy sounding. They had an enormous response, investor wise. So if this whole thing was a sham, it would be pretty disappointing. But like you said, maybe it's something that will go through this cycle and come back out stronger. But I guess we'll see.
Yeah, well, I've definitely heard Mark Hyman talking about, an idea to sort of plug in functional medicine with, with all kinds of testing. And obviously, if Theranos were to become a standard of testing, I think there's going to be options for that. I'm interested to see, how this works itself out. But yeah, interesting theme this week, hey, Gabe. I feel like, every time we obviously pick stories that are empowering to our community because we want that to be the case. But it does seem that if you look around, there's a real shift in the way, that this is being reported. And I think that more and more people are sort of becoming aware of the fact that, some of the strategies that have been seen as the only way to go have big holes in them. And then if you take that and look at the patient care aspect of it, it makes more and more sense to take the integrative approach at all times.
I think I love the combination of the last few weeks and what's starting to happen with scientific research, because if we can ever get a hold of it, we can and combine it with integration. And I think what they'll see is integrative medicine is going to get results that we're looking to get, but also we can combine with it good scientific research that who's paying for the results, how well the studies are being conducted, how consistent the experiments are. We need to all come together. And so exposing the flaws in all sides of the equation is an important part of that. And we're sort of opening up some vulnerability that we have with science right now, and that affects everyone. So it does open up an opportunity for integrative medicine to be seen as a more of an equal as we see it, because you're seeing the vulnerability of what has been this giant wall and barrier to entry in the medical model, which has been hard science, which obviously has been
God.
Yeah.
It's been God. I mean, that's really what it's been, I think. And it's interesting to see, that starting to chip away. Look, interesting week on the news. We'd love to hear your thoughts on the news that we've covered. We love getting your stuff, the things that you think are interesting. Please keep sending them to news@goevomed.com. Really happy to next week have John Weeks back on for the Convergence series and charting the convergence. He always finds some great stuff. Thanks so much for listening, and if you enjoyed it, go and check out our practice accelerator. It's goevomed.com/accelerator, and you can basically see the story of how we got here as a company and why we're creating this new product. It's been an amazing journey the last couple of weeks, and very excited to be able to bring our first product into the world. This news really has been so much fun to do. We've been doing it now, Gabe, for over 4 months. So it's been
that didn't even seem possible.
So time's been going fast, but it's been fun to bring you the news. I hope you've been finding it valuable. We'd love to hear from you. Send us stuff to news@goevomed.
Right.
Oh yeah, the articles are posted on the Facebook wall with all of the stuff. So check it out. I'm your host, James Maskell, here with Gabe Hoffman, and we'll see you next time.